Bismillahirrahmanirrahim. My topic of presentation is onchocerciasis. Keep your eyes on the stars and feet on the ground. Quote of the day. In this presentation, I am going to introduce you to onchocerciasis. We are going to discuss the epidemiological triad, chain of transmission, levels of prevention, and recent advances. Learning outcome. At the end of the presentation, you will be able to describe the epidemiological triad, prevention aspects, and recent advances of onchocerciasis. Introduction. Onchocerca, the word is a Greek word. Onkos means hook and cercas means tails, and it is commonly known as river blindness, and it is a neglected tropical disease. Discussing the global prevalence. The global burden of this disease estimated in 2070 that 20.9 million prevalent infections occur worldwide, and out of them 14.6 million have skin disease and 1.15 million has vision loss. More than 99% of infected people live in 31 African countries, and this disease also exists in some foci in Latin America and Yemen. This is an area map showing the burden of this disease worldwide in 2017. You can see the dark blue color shows high endemicity and light blue shows low endemicity, and gray and most of the endemicity is in African countries, Latin America, and few endemic cases are seen in the Yemen. Discussing the life cycle. The life cycle of this disease starts when the vector of this disease, which is a black fly, bites the human, and after the bite, the larva enters the subcutaneous tissue. It takes 6 to 12 months from larva to develop into multiple female adult worms and multiple male adult worms, and they both of the male and female adult worms then mate and form microfilary. It is these microfilary which cause the devastating complications of skin disease and the blindness. And when microfilary are produced in the person, when the black fly takes a blood meal again, then they enter the black fly and continue the remaining part of the life cycle. Coming to the epidemiological triad, which consists of agent, host, environment, and vector. Agent of this disease is a filarial worm, Onchocerca volvulus. Vector. Black flies are the vector of this disease. Female black flies are vector because they need to ingest blood for ovulation, so they feed on the humans. And mostly these black flies bite during the day. And the species of the black fly specific for this disease is Similium black fly. Coming to the host factors, all ages are susceptible and both males and females are susceptible. Environment. Environment where black flies of similium type exist, they can cause this disease. And people, these black flies are numerous around the fast flowing waters. So people who live or work near rapidly flowing streams or rivers, or where there are black flies, and agriculture areas where black flies are found, so this disease is prevalent. Discussing the levels of prevention, which include primary, secondary, and the tertiary level. Primary prevention includes health promotion and specific protection. We can educate the people regarding the disease and how can we prevent it by avoiding being bitten by infected black flies, by insecticides on exposed skins, wearing long shirts and pants, wearing permethrin treated clothing. These can all prevent the bite so that this disease can be prevented. Specific protection: there is no vaccine or medication available to prevent being infected. Secondary prevention includes early diagnosis and prompt treatment. The most common test used for diagnosis of this disease is skin snip, as shown in the image. A 1 to 2 mg shaving or biopsy of skin is done to identify the microlarvae which emerge from skin snip, and they can be seen under the microscope. When a skin snip is taken, we examine that biopsy or skin portion in microscope. Multiple microlarvae are seen, and 2 to 6 skin snips can be taken to identify the microlarvae. If there is high index of suspicion and skin snip is negative, so PCR can be done to identify those cases. And as we have already discussed in life cycle, that after the entry of microfilariae, multiple male and female adult worms live near under the skin, so they form nodules. Nodules can be surgically removed and examined for adult worms. And if there are eye infections, so they can be examined and diagnosed with slit lamp. Multiple microfilariae are seen in slit lamp examination, and antibody tests can also be used, but they are less specific and sensitive. Clinical features: usually there is skin rash, eye disease, and nodules under the skin. This image is showing nodules under the skin. These are basically the adult worms which are living under the subcutaneous tissue, so they form nodules. Treatment. Treatment is done with ivermectin. Ivermectin is going to kill the larva or microfilariae, but not the adult worms. And for removal of adult worms, surgical excision of nodules can be done for removal of adult worms. But ivermectin can only kill microlarvae, not the adult worms. In endemic areas, to control the disease, the recommended treatment is ivermectin is given every 6 months for the lifespan of an adult worm, that is 10 to 15 years. It prevents long-term skin damage and blindness. As a result of this disease, we can get complications of skin and eye. Although the ivermectin does not kill the adult worms, but it kills the microfilariae. So periodic treatment every 6 months with ivermectin is going to prevent the complications of skin and eye. Tertiary prevention can take place if ivermectin was not given and there are corneal scars, blindness, and skin deformities due to this disease. Eye disease. The eye disease of onchocerciasis is fourth leading cause of preventable blindness after cataract, glaucoma, and trachoma. Or blindness is caused by microfilariae, not the adult worms, which migrate to the eye and die, causing an inflammatory response. Over time, the affected area becomes opaque, leading to impaired vision and eventually blindness. And this blindness has many socio-economic importance. Uh, Now these are the skin changes. These occur Due to changes in color of skin, it is called as leopard skin, and ultimately there is loss of elasticity of the skin, which gives appearance of a cigarette paper. Skin disease. When microfilariae die in the sublayers of the skin, they cause skin rashes, swelling, inflammation, lesions, and intense itching. Over several years, severe dermatitis can occur. The skin wastes away and loses its elasticity, giving the appearance of early aging. This is known as lizard skin. The skin can also lose some of the pigment, giving rise to leopard skin. This is particularly common in the lower legs. Discussing about the updates of this disease. In 1974, to control the disease between 1974 to 2002, disease caused by onchocerciasis was brought under control in West Africa through the work of Onchocerciasis Control Program, using mainly spraying of insecticides against black fly larvae by helicopters and airplanes. This was supplemented by large-scale distribution of ivermectin. Now, during this time period, a large amount of insecticides were delivered in the rivers through helicopters and planes. This killed the larvae of the black fly, and side by simultaneously, ivermectin was given to people to prevent the microfilariae. So this controlled the disease. Now, after that, African program for onchocerciasis control was launched in 1995 to control onchocerciasis in remaining endemic countries in Africa, and it was closed after 2015, after beginning transition to onchocerciasis elimination. The main strategy was establishment of sustained community-directed treatment with ivermectin and vector control with environmentally safe methods. Community directed treatment with ivermectin is done where there is this disease is endemic. In 2017, representing more than 70% coverage of number of people who require treatment globally. The objectives were scale up treatment towards achievement of 100% geographical areas in areas where the disease is endemic, and where the disease has stopped, scale down or stopping treatments when transmission has been interrupted or control has been achieved. And the other objectives of this program were to strengthen information system for evidence-based action and improve the effective use of donated medicines through enhanced supply chain management. This is African program for onchocerciasis control, training and module on the community directed intervention strategy for facilities of medicine and allied health services. As this disease is also endemic in the Latin America, so onchocerciasis elimination program of the Americas began in 1992 with objective of eliminating ocular morbidity and interruption of transmission throughout the Americas by 2015 through biannual large-scale treatments with ivermectin. All 13 foci of this region achieved coverage of more than 85% in 2006, and transmission was interrupted in 11 out of 13 foci so far in 2017. Four countries have in Africa have been verified by WHO as free of onchocerciasis after successfully implementing elimination activities for decades. These countries are Colombia, Ecuador, Mexico, and Guatemala. Summarizing this disease, this is also known as river blindness. Onchocerciasis is a parasitic disease which is caused by tiny worms or microfilariae, which are transmitted by black fly. This disease affects an estimated 18 million people worldwide. Discussing the geographical distribution, this disease is endemic in Africa, Latin America, and Yemen. This disease starts when an infected insect takes blood meal from human and injects the larvae in the human skin. After that, the larvae enter the subcutaneous tissue and they form nodule and they proliferate, and the mating occurs. As a result of mating, multiple microfilariae are produced, and these microfilariae are responsible for the complications of this disease, which are the eye disease. If microfilariae migrate to eye, they cause severe lesions and in some cases blindness, and they can also cause complications of skin. Many thousands of microfilariae migrate in the upper layers of the skin. Where the microfilariae die, they cause skin rashes, lesions, intense itching, and skin depigmentation. Now it's time for the MCQs. Onchocerciasis is common cause of
C.
A, um, B, hydatitis, C, blindness, D, granulomas.
C. Blindness.
Yes, the correct answer is blindness. Onchocerciasis disease in Pakistan is pandemic, epidemic, endemic, disease not present.
Not present. D.
Yes, disease is not present in Pakistan, but black flies are present in Pakistan, so Pakistan can have acquired this disease. Vector for onchocerciasis is male similium blackfly, female similium blackfly, female
B.
sandfly, female anopheles.
Female Serenium blackfly.
Yes, the correct answer is female similium blackfly. Onchocerciasis is prevalent in regions of Asia,
D.
Africa,
Africa.
Australia, or Europe. Yes, this disease is prevalent in Africa, and it's also seen in Latin America and Yemen. A 28-year-old man from Africa complains of eye itching, pain, and lacrimation. On examination, this figure is seen. What is the diagnosis?
Ocular
Viral conjunct.
onchocerciasis.
Uh, this is ocular onchocerciasis, and we can see this is a microfilariae, as a result of which intense inflammation has taken place in the eye. Best test for diagnosing onchocerciasis is skin snip, CBC, antibody test, or radiography.
A. Skin snip.
Yes, skin snip is the best test for diagnosing the onchocerciasis, in which after skin snip, multiple microfilariae are seen in when examined beneath the microscope. Which of the following is not seen in onchocerciasis? Leopard skin, blindness, hepatosplenomegaly, nodules on skin.
C. Hepatosplenomegaly.
Yes, the correct answer is hepatosplenomegaly. Which one of these is a neglected tropical disease? Poliomyelitis, hepatitis B, AIDS, and onchocerciasis.
B. Onchocerciasis.
Yes, onchocerciasis is a neglected tropical disease. Neglected tropical diseases are those diseases which are affect the world's poorest population and have received less attention in the past because they are thought that they are affect only the poor countries. Mass prophylaxis for onchocerciasis is done with praziquantel, ivermectin, metronidazole, or sulfonamides.
B. Ivermectin.
Yes, ivermectin is the drug of choice for mass prophylaxis of this disease. Blindness in onchocerciasis occurs due to male adult of Onchocerca volvulus, female adult of Onchocerca volvulus, microfilary or black fly bite.
It's the microflare.
Yes, microfilary causes the complications of this disease, which includes the ocular complications and the skin complications. This is the key of my presentation, and here are the references. And thank you. Any questions?
Thank you so much, Dr. Marine. It was basically a wonderful presentation regarding onchocerciasis. As we all know, it is a river blindness, also known as the river blindness. It's a disease caused by the infection, and symptoms include severe itching, bumps under the skin, and blindness. And it is one of the second most common cause of the blindness due to the infection after trachoma. Thank you so much. Anyone with the questions? Thank you so much. Now we end this presentation. Allah Hafiz.
Allah Hafiz.